Thank you very much for coming tonight to our incredibly timely healthcare forum, which is entitled ACA Repeal and Replace, What's the Latest? My name's Tom Rice. I'm a professor in the Department of Health Policy and Management here in the Fielding School. I'd like to begin first by thanking Dr. Torrens and the many donors who you see listed there who've helped make all of these sessions possible, and also to Dr. Kaminsky and the UCLA Center for Health Policy Health Policy Research for organizing and co-sponsoring this event. We're live streaming, so please mute or turn off all your devices. And for those of us joining us online, I think this is the first time we've done that. Thanks so much for participating, and you'll have an opportunity to ask questions during the Q&A period. We'll tell you a little bit more about that later. As you all know, during the presidential campaign, Donald Trump vowed to repeal and replace the Affordable Care Act, and ultimately his administration did not come up with its own plan. Rather, it borrowed a plan from Speaker Paul Ryan and the Republican majority. It's called the American Health Care Act of 2017, or the AHCA. It's already passed 3 House committees. There's a very good chance it will go before the full House tomorrow. We shall see. But even if it passes the full House, its fate in the Senate is certainly up for grabs. One could imagine a scenario where it would take a turn to the right, perhaps even a scenario, maybe less likely, a turn to the left, or maybe even plausibly a bill won't even pass at all, and we'll obviously be discussing that tonight. The outcome of this process is just crucial to the American people and the public's health. As most of you know, the Congressional Budget Office estimates that 24 million Americans will lose their insurance if this legislation is implemented. And as we'll also hear tonight, local efforts to improve the public's health will also be severely threatened by the reduction in the federal support for those efforts. One major question, I guess this will be determined by the Democratic senators, is what the Democrats can try to do to preserve President Obama's his signature legislative achievement. Anyway, these are exciting issues, and to address them, we have probably about as good of a panel as you could possibly have, certainly on this coast. I'm going to introduce all 3 speakers now so we can just proceed without interruption. And there's much longer bios in the program that you have, so I'm going to keep it very brief. Our first speaker is Professor Gerald Kaminsky. He's a professor in my department, Health Policy and Management in the Fielding School, and director of the Center for Health Policy Research at UCLA. And he's one of a handful of leading experts on the ACA in the state of California. And those of you who follow the LA Times, you'll see that he's quoted very often there and also on local and even national radio. Our second speaker is Alexander Lee. Dr. Lee is Deputy Director of Systems Integration for the LA County Health Agency. And previously, he was a Medical Director of Medical Management, LA Care Health Plan. And he's also a practicing physician. And he's going to discuss how the ACA repeal and replace will affect the public health in Los Angeles and California. And our final speaker is Mark Peterson. Mark is a professor of public policy in the Luskin School of Public Affairs here at UCLA. He has joint appointments in political science, and in looking at his bio online, I learned for the first time that he's also in the law school. So congratulations, Mark. He is, in my view, our campus's leading expert on the politics of health policy, his particular expertise on both Congress and the executive branch. So he'll be speaking about the politics of repeal and replace. So following the presentations, we'll have Q&A. There's going to be plenty of time for that. And we're actually going to intermingle it, questions from the audience and questions that have been submitted online. So without further ado, let's start with the panel. Dr. Kaminsky.